In this episode of Medicine in Blue and White, the incredible connection between one 14-year-old boy and the thousands of people he has helped over the past 40 years.
Best way I found to describe it is just a sea of human kindness.
Combining aerospace engineering and medical technology to help improve healthcare in developing countries.
Obtaining this technology is a big deal.
Never-before-seen behavior under the microscope that could lead to a cure for some of the most challenging diseases we face.
Now that we've seen it happen, why is it happening?
And a new way to test for what is literally an age-old problem.
Most people do not realize they have the disease.
You'll find it all here at Penn State Milton S. Hershey Medical Center. Founded in 1963, committed to enhancing quality of life, educating future generations, and discovering what lies ahead. Here you will find the full spectrum of what it means to be human, dreams, fears, hope. Doctors, nurses, and researchers, where time-honored values meet the latest in breakthrough technologies, with the most important goals always in mind: to heal the sick, ease the suffering, and make life a little better when you can. It is Medicine in Blue and White. You wouldn't expect 15,000 Penn State students to have all that much in common with a 14-year-old boy named Chris Millard. But that's what makes this story so special. In fact, the 15,000 are part of an annual event called THON, Penn State's Dance Marathon. But it's not just any event. It's the largest student-run philanthropy in the world. And Chris Millard was not just any kid. Before he died of cancer at the age of 14, he wrote a short story called The Four Diamonds, calling out the very best of human qualities: courage, honesty, wisdom, and strength. The Four Diamonds Fund, a charitable organization set up by Chris's parents in his memory in 1972, has been helping families who themselves have a child battling cancer at Penn State Hershey Children's Hospital. And that's where THON comes back into the picture. The money raised here, and to date it's been more than $78 million, goes directly to the Four Diamonds Fund, providing financial, social, and emotional support to the kids and families affected by pediatric cancers. The fund's ultimate goal? To conquer childhood cancer, period.
We're offering support in outstanding care to the patients. We're offering comprehensive support to the families. And we also make an enormous investment in innovative research to search for the cure and also to find less toxic ways to treat pediatric cancer until we find the cure.
About 100 new families receive support each year. You're about to meet two of them. We'll begin with Michael, diagnosed in 2008.
Freshman year, I had very itchy skin, and I didn't know what that was all about, so I went to the doctors for a checkup, and it turned out to be cancer, so Hodgkin's lymphoma, and so that was a big shock.
And a big life change. His first course of treatment was 3 months of chemotherapy. It failed to get rid of the cancer. Then he underwent 3 months of radiation. That didn't cure it either.
His radiologist said 99% of children with Hodgkin's lymphoma 2, stage 2, would be cured with the chemotherapy and a radiation. 99%, and he wasn't. He still had cancer. So he fell in a 1% category. I mean, who does that? Who is a 1%? I didn't think anybody was ever 1%. I always thought that was just some kind of statistical error. So that's when we really, really were scared. We were just afraid that there was nothing, there's going to be nothing that was going to cure him.
12-year-old Deandra was diagnosed with leukemia in March 2009.
We were really scared and we didn't know what was going to happen or what we were going to have to do.
When she was very first diagnosed, we were in the hospital for about a week while they got her chemotherapy started, and we're just kind of taking us through everything that needed to be done and what we were going to start doing for treatment. And I think it was probably the second night in the hospital when I finally had a chance to just sit down and relax. I got to thinking, oh my gosh, like how am I ever going to pay? I'm going to lose my house. Just what's going to go on as far as money, because I'm looking at all the things they're already starting to do to her in 2 days.
That's when the King family learned firsthand just what it means to be a Four Diamonds family, something the Brodas had learned as well.
They are very, very supportive, and we didn't really need them that much financially because we had good health insurance, luckily, but we didn't know that at first. We didn't know what the health insurance was going to cover. We didn't know how long Michael was going to be treated. We didn't know if there was some kind of cap on our insurance. It was so many questions, but to know that Four Diamonds is right there, that it's such a safety net, it was so comforting.
It's very stressful, and what a lot of people tell me is they feel like they're in a pressure cooker. And that's what we and our staff are here for, to really help diffuse that tension, to try to help find people resources that they really can lead as normal a life as possible through this process, and to walk them through the process step by step with the least anxiety as possible, knowing that we're going to be there to answer questions and help support them. So your brother's getting collected right now? Are you nervous about that?
No, not really. No? We provide financial assistance for families, covering things like deductibles and co-pays and prescription drug coverage for the care that they're receiving here at Penn State Hershey Children's Hospital. But we're also making sure that specialists are available to help the families. We have child life specialists, clinical nutritionist, music therapist. So we're really able to offer a really comprehensive way of treating the patient and the family.
Cancer remains the #1 cause of death by disease for children. There are 12 major types of childhood cancers, the causes of which are largely unknown. On average in the United States, about 12,500 kids and teens are diagnosed each year. Despite initial treatments, Deandra and Michael's cancers have not gone away. But the Four Diamonds Fund will continue to support them on their journey. What lies ahead for both is a stem cell transplant at Penn State Hershey's dedicated state-of-the-art pediatric transplantation unit. Patients receive stem cells from healthy bone marrow, harvested from their own body, a close relative, or an unrelated matched donor. Advances in tissue matching help make sure each patient gets the stem cells they need.
You're really better able to get a perfectly matched donor. We also have an expanded donor pool. Rather than having a few thousand donors in the unrelated donor registry, we have millions of donors in the unrelated registry and approximately 500,000 cord blood donors that are frozen down and ready to ship anytime.
And that's comforting news for Michael and Deandra in case their own primary sources for stem cells do not work out. Michael's doctors will harvest his own bone marrow for the procedure. Deandra is depending on cells from a donor close to her heart, her little brother Gavin.
If you have a sibling match, it's easier than having a non-sibling match because then you have to wait for your donor and stuff. And my brother was a 100% match.
Doctors, nurses, social workers, therapists, and consultants will be with them every step of the way, along with, of course, 15,000 of their newest, closest friends. Coming up on Medicine in Blue and White, the connection between this and this. Penn State Milton S. Hershey Medical Center, home to a world-class pediatric stem cell transplantation program. Michael's journey with Hodgkin's lymphoma led him here and started when he was just 14 years old. Outpatient chemotherapy and radiation failed to cure his cancer.
So they moved on to high-dose chemotherapy with a stem cell transplant. And that was probably the most extensive of all the treatments.
And the one that could change his life. Deandra was diagnosed 2 years ago. Her leukemia is stubborn, and she too will undergo a stem cell transplant.
The cancer was gone and then it came back, and instead of doing more chemo they thought about doing a bone marrow transplant.
With new medicines and technologies, survival rates for pediatric cancers are rising significantly, from nearly 60% in 1975 to about 80% today. But that's only in the United States. We'll continue to follow Michael and Deandra in just a few minutes. But in order to help put their stories into a global perspective, consider this. More than 60% of the world's children with cancer have little or no access to effective therapy. And the lack goes beyond just pediatric cancers. It's no secret, of course, that many of those who seek health care in developing nations are left wanting. A Penn State Hershey team of doctors, scientists, and engineers is working to help change that. And they're starting with this, the CAT scan, a special type of X-ray machine that's been around since the 1970s. It uses digital geometry to give doctors a 3D view inside the body. Because it's been around for 40 years, many poorer communities have access to one, and this team wants to take advantage of that. The goal? Make the existing machines smarter so that they can see more.
Obtaining this technology is a big deal. It's a little bit like using a satellite picture to try to find details of a farm field. It looks very fuzzy and it's very far away, but you can process that better in order to pull out very effective and useful information from it.
To help them do that, the Penn State Hershey team is adapting military aircraft technology. They are using the same complex mathematical algorithms that help pilots track targets to upgrade CAT scans to better target disease.
We've worked with some of our aeronautical engineers. They use ways of tracking terrain. The way that they do that has been well worked out, and it's something that we are actually able to apply to CAT scans. And what we find is that it can, just as it can guide an airframe to fly somewhere when it has a topographical map, with a bit of tweaking, one can get these aeronautical engineering algorithms to do a smart job of flying around the contours of the brain.
Two conditions that could be impacted are epilepsy and hydrocephalus, or water on the brain. Doctors will be able to treat both better with the improved CAT scans. And there are a lot of people in need. 50 million people in the world have epilepsy, the most common serious neurological disorder. More than 40 million of them are thought to be in developing countries. And 90% of them, some 36 million people, are not receiving appropriate treatment. As for hydrocephalus, it's one of the most common birth defects, affecting about 1 child in 500, making it more common than Down syndrome or deafness. Enhanced CAT scans to help visualize the brain will be crucial in treating the condition.
With rocket science and CT scan, you can actually follow the growth of the brain very carefully. You can tell how many grams it weighs this month and how many grams you've grown next month. And this is a way that we can do that better.
Coming up next on Medicine in Blue and White.
Most people do not realize they have the disease.
From the retina to the retrovirus.
Now that we've seen it happen, why is it happening?
From what our eyes are able to see to what we've never seen before, Penn State Hershey's doctors and researchers are working it all. You're looking at a retrovirus. At its simplest, it's a biological agent that reproduces inside a host cell, but changes its genetic makeup faster than other viruses. Some are linked to life-threatening diseases, and though they have existed for millions of years, scientists still have a lot of unanswered questions.
The first thing that we were really interested in is how does the virus use the cell to make more virus particles? Because that's really sort of the goal of a virus, is to reproduce. And so we started to try to understand what cellular machinery was hijacked by the virus for it to be able to assemble new virus particles that then go on and spread to another cell.
This is what is causing all the excitement. For the very first time, researchers can see a retrovirus use the nucleus of a cell in order to make more copies of itself, something the scientific community thought never happened. Knowing how viruses operate is key to finding cures for the diseases they cause.
In order to treat virus infections, we really have to understand how they replicate at a very minute level. So a very detailed view of how the virus is working in the cell allows us to interfere with steps in the replication cycle. So if we can really understand it better, we would have a chance to come up with strategies to block the virus from taking over the cell for this purpose.
Currently, there are only 3 known infectious human retroviruses, and they're linked to HIV, cancer, and neurological disease. So while this team is excited about their discovery, they realize there is much more work ahead.
We're always kind of thinking about our work because not only is it really interesting and exciting, but we think it does have broader implications that could someday be useful for a treatment.
Treatment news of a different sort. It's a disease that affects some 13 million Americans, and yet 85% of them don't even know that they have it. It's called macular degeneration.
Macular degeneration is the leading cause of irreversible blindness among older adults over the age of 65 in the Western world. It's a progressive chronic disease in which the central part of your vision, the part of vision we use for reading, seeing people's faces, or driving, deteriorates.
Unlike glaucoma, which affects about 4 million Americans, macular degeneration is an especially challenging disease because it can come on so slowly and gets confused with the normal aging process.
If you have a sudden decrease in your ability to read, only bad things cause that. That's not your prescription normally changing. If you're looking at a piece of graph paper and some of the lines in the periphery of that graph paper off to the sides of your vision become wavy when you know that they're supposed to be straight, that's a classic symptom of having bleeding in the eye.
Right now, there is no cure for macular degeneration. Until now, there wasn't even a test for it. That's about to change. Dr. Jackson's team found an early warning symptom that largely goes unnoticed: night vision, or to be more precise, the gradual loss of it. Think of going from bright sunlight into a darkened movie theater. How long does it take your eyes to adjust? Researchers found that the cells responsible for night vision are affected by macular degeneration long before and more severely than those that enable sight during the day. But they weren't being tested. The team developed screening technology to measure that adjustment period. The patient sees a flash of light and then pushes a button when they see a more faint green light.
For someone that's a younger person, it may take 8 minutes to complete the test. And for someone who's slightly older, it may take 9 minutes to complete the test. But the earliest stage of this disease, it may take 16 minutes to complete the test. And if you have the late stage disease, it could take an hour to 90 minutes to complete the test.
The screening will be widely available soon.
I think that every patient over the age of 50 should be screened on a yearly basis for this disease, and using a 5-minute screening test as part of your normal eye exam would be a way to identify these patients early. And there's great hope for the future.
Early detection could help to arrest the disease that causes so much damage to so many people. Coming up next on Medicine in Blue and White.
I don't sweat the small stuff.
Michael Broda was a freshman in high school when he found out he had Hodgkin's lymphoma. Since his stem cell transplant, he's been cancer-free. He says his guitar and his dog Yogi helped get him through, along with a once-in-a-lifetime backstage visit with Sir Paul McCartney, made possible by the Make-A-Wish Foundation.
He said he was honored for, having me be his wish. So, and he gave me a guitar, actually, autographed it and everything.
Add to that the 15,000 Penn State students who are part of Thon, the world's oldest and largest student-run charity. Thon's proceeds go to the 4 Diamonds Fund, which helps all families here dealing with pediatric cancer. He got to see it for himself last year.
It was pretty emotional, like, because all those people in the Bryce Jordan Center, they're all doing it for people like me. And, you know, without them, you know, who knows, I might not be here.
He's off to college now, and while he's not quite sure what his major will be, he knows that after what he's been through, he'll be able to handle anything that comes his way.
I feel like I rarely get upset over, like, anything, really. Like, things just, I don't know, I just go with the flow with everything, and, you know, I just don't worry about I don't sweat the small stuff.
Gavin King went back to school a hero after donating bone marrow for his sister's stem cell transplant.
They said, "That's really brave of you." And the first day that I came back, I forget what her name was, a girl held my books for me for math. So yeah, it was pretty fun.
Deandra, too, is now cancer-free. Her strength, she says, comes from family and friends. But it is not an easy journey for such a young soul.
After, like, going through this and everything that's happened over the past 2 years, I do feel like I can do anything.
But feeling better can be very scary, too. Deandra will continue to work with the whole team here to make sure her cancer stays in remission. Her future is bright, with some plans that put big smiles on a lot of faces around here.
I have like a list of different things that I want to be, like a lawyer and a teacher and a chef. But I think I know where I'm going to go to college. I'm going to go to Penn State.
For more information on the stories featured, visit pennstatehershey.org/blue and white.